Dr. May, thank you for being here with us and for talking about your research at the American College of Cardiology Scientific Session. Tell us a little bit about the trial that you have presented involving the Intermountain risk score.
Sure. So we have shown in many studies that the Intermountain risk score is predictive of poor outcomes, but we've never looked at chronic diseases. So what we did in this study is that we took just the components of the Intermountain risk score, which are commonly obtained laboratory measurements that any patient might get at their checkups. And we took that and looked at patients without any chronic disease like heart disease, diabetes, renal failure, COPD, and just there was 10 chronic diseases that we looked at. And we created a risk score specifically using the Intermountain risk score components and for a 3-year chronic disease outcome. And we were able to successfully create a risk score that predicted a 3-year chronic disease among these patients. And we looked at about 145,000 patients, and we found those in the high risk category for males. 30% of them had a chronic disease risk diagnosis at 3 years, and for females it was 20%. So it did well at stratifying risk and identifying patients who are at high risk.
What do you take with this data that you've learned from this trial?
Sure. The Intermountain risk score is currently being implemented in electronic medical records because it's been able to be computed electronically, it's free, and what we hope is that ICHRON, which we term this risk score, can then also be integrated into an electronic medical record, and that clinicians can identify those high-risk patients and maybe create a more personalized care plan for them.
Well, that's exciting. So this does have an impact on those patients with chronic illness.
Yeah, absolutely. Chronic illness is a really thing that really affects the population, with over half the people in the United States having a chronic disease.
Well, great. Thank you for being with us today.